Hi, my name is Dr. Kevin Petersen. I'm a general surgeon and I do many different types of operations, but one of the most common operations I do is a hernia repair. Hernia operations are one of the most common operations that occur in the United States. I've been in practice now for 25 years. I've repaired about 5,000 hernias, and my preferred technique for repairing hernias is an open non-mesh repair. I am a surgeon who will accept patients from other doctors who have complications from hernia mesh. The problem with mesh is that in a certain percentage of patients, their body simply identifies the mesh as a foreign material and will reject it. And if your body rejects the mesh that's been implanted in you by a hernia surgeon, really the response of your body is to build scar tissue around the mesh. The scar tissue leads to chronic pain. It also causes the mesh to shrink and shrivel up. And when the mesh shrinks, it pulls on its anchors and can actually detach and then dislodge and free itself from the covering of the hernia, and the hernia comes back. This particular mesh was put in a 30-year-old who had his hernia repaired 2 years ago, and from the time after that surgery continuously until we operated on him to remove the mesh, he had chronic pain that kept him from working, and he was actually on disability. This is a mesh plug that was put in a 60-year-old gentleman 6 months before he came to see me. And he had pain on a scale of 1 to 10, which was 10. I have seen mesh come and go. I've seen mesh that has produced fatal complications in patients and be taken off the market by the FDA. All during this time, I continued my non-mesh repair with my own patients and achieved very good results. My recurrence rate is less than 3%. Also very important now is the fact that in my patients that I'm not using the mesh for, my incidence of severe chronic pain is essentially zero. For the umbilical hernias, I use another technique which is called a pledgeted repair. This is a pledget. A pledget is a little piece of felt. When it's being used to close the hernia, the suture actually goes through the pledget in and out, and it acts basically like a washer would with a screw. When we use this on umbilical hernias, it produces a very secure repair. Anybody who is interested in getting more information from us about non-mesh repair can find us on the internet at www.noinsurancesurgery.com.